Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hola, ¿qué tal, Nita?
How's it going?
I'm living it up, totally. I don't see Dr. Grove on the line here, so I hope.
Oh, can you guys hear me?
Oh, there you go. Yeah, you're going in direct.
Hey, good morning, guys.
Good morning.
I was just thinking we're going to have to put in the byline in the beginning of the show how it's Dr. Darrow and Dr. Grove. Now, Dr. Grove.
Yes, sir.
Yes, sir. Dr. Grove, you can go to our website, jointrehab.com, which is an amazingly educational website. It's got tons of studies in it, and in our office we do research. Dr. Grove has been with us for, wow, it's like more than, 6, 7, 8 months or so now, and
yeah.
he is burning it up with healing. That sounds funny. But he is, in my humble opinion, one of the greatest doctors on the planet, and you will love him. He's got a great personality. He's a big, handsome dude. He played football for the Cornhuskers. He was the captain or the co-captain of the team. And if you go to the website, www.jointrehab.com, and one of the menu buttons, you'll see his bio and photos of him on the football team. And you'll see his great information. So what we're here to do today is the show is called Living Pain-Free. And what that means is we do regenerative medicine. That's something you may not yet have heard of. It's a newer term, and in the old days it was called prolotherapy, proliferative therapy, which is therapy by injection that stimulates new tissue to grow in your body. So if you have an orthopedic injury, the whole thrust of this is instead of getting surgery, which fails miserably in many, many cases, you just walk in the office. You don't need anyone to drive you. You don't need anesthetic. Dr. Grove does the injections now. I've been doing that for over 27 years, and my hands are a little bit stiff, so Dr. Grove is doing all the injections now, and he's got a very sensitive touch, and people love him dramatically. I know people always loved me, thank goodness, and I think they love Dr. Grove very much the way they love me. And we both have, we love our patients. That's basically it. And we laugh all day long at the office about how much fun it is doing the work we do to heal people. Instead of, cutting people. We both did a lot of surgery in our training, and we love it, but it's not the best way to go in our opinion. And it's a lot simpler to just get an injection and walk out. So it's pretty simple work to do. Today, the way it's done is to use mostly PRP, which is platelet-rich plasma, and stem cells. And I'll let Dr. Grove talk a little bit now so you can hear his voice. And I'm going to give out the phone number a few times so you can actually call and talk to Dr. Grove and ask us questions, or talk to me, talk to both of us. So the phone number, if you want to call in to the studio right now, is 866-870-5752. I'm going to repeat it. Go run and grab your pen and pencil. It's 866-870-5752. For anyone that calls in, we are going to mail them for free a book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That's where the regenerative medicine term is coming out. you have an option. You don't have to operate in most cases. Now, I want to make sure you understand this is not a statement against surgeons. Surgeons, I think, do the hardest work in medicine. And, when Dr. Grove and I did it, we're on our feet, 12, 16, 18 hours a day sometimes. And it's exhausting. And there's a lot of terrible side effects. I've actually seen people die on the table. Terrible things can happen. And you folks, if you haven't had it happen to you, God bless you. I'm glad it hasn't. But you probably know stories of people that have had terrible surgical outcomes. So, again, the phone number to the studio to talk to us live right now is 866-870-5752. And Nita, if you see someone calling in, you can just cut Dr. Thomas Grove and I off.
Okay.
Because we're very chatty guys. And when we get going, there's not much room for anybody else to talk.
I've noticed. But that's okay. You have a lot to share, and you're enthusiastic about it, and people need to know this information.
Yeah. So if anyone wants to call the office, because you can get a lot of information from our staff, and you can get a free consult from our staff right on the phone, not from me or Dr. Grove, but the staff knows an awful lot. So if for some reason you're too shy to call in, and I hope you're not, because we're very, very sweet to our callers, and the phone number to the office is 800-300-9300. I'll repeat it for you. Write it down. 800-300-9300. And again, if you want to email us, we answer every email every single day. The website has a spot on every page to email us with any questions about orthopedic medicine, musculoskeletal medicine, which has to do, in our work, from the top of the head all the way down to the bottom of the feet. We inject everything. So if you have arthritis anywhere, neck, back, any of the joints, we handle that. Neck pain, back pain, rotator cuff tears in the shoulders, labral tears in the shoulders, elbow issues, annular tears in the elbows. A lot of pitchers get that, and they have surgery and it doesn't work out too well. It can be muscle tears, tendon tears, ligament tears, hip arthritis, labral tears in the hip, knee meniscal tears, MCL tears, anything. It doesn't really matter. We do a lot of ACL ruptures, and the new studies show that you don't need to have a surgery to repair an ACL. And Dr. Grove, do you want to talk about that a little bit? I know you were showing me some research on it yesterday.
Yeah, so it's a really exciting area of orthopedic medicine, looking at non-operative ways to treat very common injuries that you see not only in athletes, but everyday people as well. So the ACL, the anterior cruciate ligament, is one of those hot topics right now, being researched, looking at utilizing regenerative medicine with stem cells and or PRP to see if you can get that ligament to heal up without having the surgery. Like we talked about, surgeries, it's great to do. It's a really hard field to operate in. The downsides are, potential infection, the lengthy downtimes, the rehab. God forbid you had a reaction to the anesthesia compared to non-operative treatments, which doesn't carry those same risks. So it's really exciting research coming out looking at using regenerative medicine to treat these injuries with great success, even within a couple of months, having the same or better outcomes without having the risk of having the surgery. So it's a really exciting area of research being done right now.
I was just telling Dr. Grove in the office yesterday that I've been treating ACL ruptures for the last 27 years. And I don't know one of them after doing regenerative medicine that has ever had a problem. And I know that's insane if you tell that to an orthopedic surgeon, because in their mind you have to go in, open it up, and stitch it back together. But Dr. Grove, do you know what the failure rate is after an ACL surgery?
Much, much higher than people would think.
Yeah, and that happens because that ligament that is replaced, which is taken typically from the medial or middle part of the patellar tendon or the hamstring tendon, or from a cadaver, from a dead person's ligaments. And that's put in. That actually dissolves away and is replaced with new tissue. And during that healing period, most people that have these ACL ruptures get very frustrated because it's a minimum 9-month rehab healing. And during that time, they often will re-rip it. So we have so many patients that come in who have had re-torn ACLs. And what I find is very simple. As soon as someone comes in the office with a swollen knee, and very often they've already been to an orthopedic surgeon, they have their MRI, it shows an ACL rupture. But by the way, that can be false also because MRIs are overly sensitive. And sometimes we would go in when we'd see an ACL rupture on a knee, and we'd open it up and find out it wasn't even ruptured.
So speaking of knees, not to interrupt you gentlemen, but we do have John with a knee problem calling from Santa Clarita.
All right. John, Dr. Marc Darrow, how are you doing?
Hello.
Yell at us a little bit so we can hear you.
Okay, I'm yelling.
Okay. How long has your knee bothered you for?
Probably 5 years, 7 years, 8 years.
Okay. And you were told you have arthritis in your knee and you need to get a knee replacement. Is that correct?
I just went in, met a doctor at Kaiser, and he just said, "Oh, you need a knee replacement." And I'd heard your program in the past, and I just said, "You don't know what you're talking about." And anyway, it blew up, and I left. And then I
hear you.
Your program, and something about regenerate your knees, don't operate. And then I thought I'd better just call in and see what's going on.
Cool. So here's Dr. Grove and my experience with this. Most of the knees we treat, and we treat tons of knees all day long. It's probably the number one thing that we treat. Most of them heal up. And I have to be honest with you and transparent. Using stem cells and platelets doesn't heal everybody. And there's many reasons for that. One is the patient can be too active after the treatment, so they don't let the tissue grow back in. Another is they can be taking ibuprofen or other anti-inflammatory medications, and that will block the inflammation that's needed to grow new tissue. Then sometimes it's because the patient doesn't have enough treatment. We have patients come back 2 weeks after each treatment, and a lot of times people say, well, it didn't work. Well, it's not supposed to necessarily work that quickly, especially if a person's active. You know, it's not some panacea for pain. It doesn't heal everything immediately. And, you know, I use my own body as a gauge for this. I've self-injected both my knees, both my elbows, my right wrist, and both of my shoulders. I've had other people I had some broken ribs. I had one of my staff members inject that. And I had neck and back arthritis. And I had other doctors who do this work inject that for me. And I had costochondritis, which is an inflammation between the ribs, all over my back. So I had hundreds of injections on my body. And if I'm injured today, I'm gonna run today, I'm gonna lift weights, and I'm gonna play golf. If I get injured, guess who's gonna be injecting me tomorrow? Dr. Grove.
Yes, sir.
Okay? I don't mess around because I know this stuff works. But I have to say, there's been certain injuries I've had that have taken a long time to heal with several injections. So if you want to come in, don't have the expectation that this is a miracle. I mean, to me, it's a miracle compared to what else is out there. But it just makes sense. We inject cells into the body that stimulate tissue to grow and wake up the nascent stem cells that are already there. Nascent means sleeping. We have stem cells all over our body. They're being released by the bone marrow every second. All right? But a lot of them are sitting there and not being active. So when we do these injections, it can, in a sense, wake them up and put them to work. The other thing is, one more thing, John. The other thing is many doctors who do this work do not use an ultrasound. If you don't use an ultrasound, you don't know where that solution is going. We use the ultrasound, number one, for diagnostics, and believe me, Dr. Grove is one of the finest ultrasound technicians I've ever seen. And he uses that for all of his injections. So we can actually see the needle entering the body and being inside the body, so we can deposit the platelets or stem cells exactly where they need to go. And studies show that if doctors do blind injections, that means they don't use an ultrasound or a fluoroscopy, that they're going to miss joints 1/3 or more of the time. So people come in all the time and say, we went somewhere else, it didn't work. How come? Did they use an ultrasound? No. Did they touch the body? Did they touch you? No. Well, if they don't touch you, how do you know where the pain is coming from? And the poor patient says, well, they showed me an MRI. MRIs don't tell you where pain is coming from. We talk about that, Dr. Grove and I laugh about the reality versus the pathology. Pathology is what doctors think it is because they looked at an image. They never even touched the body or moved it around to see where the pain is coming from. They never found the pain generator. So keep that in mind. Reality is what is going on. Pathology is what doctors think is going on. And I would say the majority of patients that come in to see us have the wrong diagnosis to begin with. So
yeah, it's pretty remarkable when you think about someone coming in with a preconceived notion of where their pain is, but their medical provider never put hands on them. They never did a proper physical exam. So that's the challenge from the provider standpoint, is we have to try to figure out where the pain's coming from. And if you're just guessing or you're just blindly putting a needle in generally where the area is, it's no wonder why we don't have optimal outcomes for these kind of treatments.
A good example of this is a woman who came in about almost 2 weeks ago from Palm Springs. And she had low back pain and what she called sciatica. So ready for surgery, right? Go to have back surgery. Cut some disc tissue out. Cut some bone off. Blah, blah, blah. So Dr. Grove injected her one time, and she just called me yesterday. And she said, I can't believe this. The pain down my leg is gone. I still have a little bit of back pain. How did that happen? A lot of these pains down, or what we call paresthesias, which can be numbing, tingling, or just pain down our limbs, down our arms or legs, aren't necessarily even coming from herniated discs, even if you have a herniated disc. I have herniated discs in my neck and my back. I don't have any pain down my limbs. Why is that? Because it's not the cause of anything. So at any rate, many times people have what we call a radiculopathy, meaning a nerve that's pinched in the neck or back and that goes down the arms. But it isn't a radiculopathy. It's a referral pattern from the ligaments in the neck or the back. So we inject the areas where the local pain is, and sometimes you don't even have to have pain. You can have arm or leg pain and not have neck or back pain. And that can be injected in the back or the neck, and very often the referral pattern will go away. So we have to be very careful to save people from having surgery.
Okay. Well, I believe in you guys. I've been listening to you for years.
Oh, great. Thank you so much, John.
Yeah.
Anyway, we'd love to see you. If you want to come into the office, give us a call now. At the office, the phone number is 800-300-9300. Yeah, 800-300-9300.
Okay.
And for those of you that want to talk to Dr. Grove or myself live right now on the radio, you can call the studio at 866-870-5752. So before we let you go, John, can you tell us what part of your knee actually bothers you?
I let him go. Sorry. John, you can call us back.
That's 2 weeks in a row.
I thought you were moving on.
I know what you thought.
Sorry about that. Hey, John, call us back. We're not done with you. 866-870-5752. 866-870.
All right, so we're going to go on. Dr. Grove and I are going to go on to some questions here.
How about another body part?
How about you let us do the show?
Okay.
I'm going to move into a new subject matter here, which is something that I've been doing for many, many years. And at one point, my practice was all about natural healing, 50% natural healing, what they call functional medicine and anti-aging, and the other half was orthopedics, which we do quite a bit of. And in the natural medicine part, we're doing more and more of hormone replacement therapy for men and women. So as people age past their 20s, their testosterone for males decreases, and a man, as he gets into his often in 40s, definitely 50s, 60s, and 70s, finds that they have what's called erectile dysfunction and have difficulty in their relationships because of it. And there's something that I found out about a few years ago, and I've been leaning into it more and more, and I found it to be very successful, which is called the P shot. And you can imagine what the P stands for. So it's using platelet-rich plasma or adding stem cells to it to inject actually into the penis, which will wake it up again, you might say. And what it does is, as men get older, and as everybody gets older, the vasculature in the whole body starts to decay in a sense. It gets filled with plaques and things like that. And when that happens in men, they lose erections. So doing these injections, it's very simple. The area is numbed up with a numbing cream, just like we do when we do aesthetics on the face. We put numbing cream on. It really doesn't hurt. You think it would, but it doesn't. And so that is one thing that we're finding is pretty remarkable. And I think that the platelets also reawaken and heal the nerves there. So other things that can be used for that, obviously, there are other treatments. Xiaflex is a collagenase, which is falling out of favor. It's an injection that urologists do, but there's way too many side effects. We know about the different medicines people can take, like Cialis, Levitra, Viagra, and those work for a while with people, and often it stops working. Surgical implants, I think that's a terrible idea. Another thing that can help is using L-citrulline, which is a vasodilator which increases blood flow through what's called cyclic AMC. So these are all things that can be done. Men can also use what's called extracorporeal shockwave treatment, which is a direct application of shock waves, and that can help regenerate tissue also. There's a lot of ways to help regenerate different parts of the body. So it's an exciting field. The P-shot is something that I really believe in. I've seen many results from it. If you look it up on YouTube, you'll hear people talk about it. You'll hear doctors talk about it. You'll hear patients talk about it. And it's, with this new age we live in, people are not getting older. They want to stay young. And our relationships with our spouses and our friends, girlfriends, boyfriends, whatever it is somewhat dependent on sexual health. So it's a field that I love working in, and I hope that you'll dig into it. There's a website that I have called MyAgeMD, which talks about the different hormones that we use. And for women, we give them estrogen, progesterone, and testosterone, believe it or not. Women lose that too. And what I find is when women have a baby, they lose their hormones. When they have a hysterectomy, they lose them. And just with natural aging, they lose them. Even premenopausal women lose their hormones. And men lose their testosterone, as I said, once they're past 20, the levels start decreasing. So it's an interesting field, and if you're in that area or that age group where you think it's important, you can give me you ping me on the website, www.jointrehab.com, and if you look under conditions on the top menu bar, there's a lot of information there about sexual health. We're going to the break. Give us a call at the studio, 866-870-5860. 5752, 866-870-5752. And thank you, Nita Valens, for being a great host.
Well, thank you, and we'll be right back after these messages. Stay
You're
tuned.
listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.